or you want to just start?
We only have 14 out of the 26. So I don't know if you want to give a couple more minutes or...
yeah, I think we should.
Okay.
Yeah.
Maybe we can go till 5 after, and then you can just start us off with the introductions.
Perfect.
And it'd probably be easier if people use the chat box, if they would have questions or raise their hand. And then once we get to the question sessions of that part, we can go ahead and unmute them. If they would prefer to ask it over the phone, or they can just type the question to you. And Melissa, you're able to see the login screen for CAREWare?
Not sure which one, but yeah, I am.
Okay, great.
Yeah.
Yeah, we still only have 14 out of the original 26. So we might be missing maybe 4 folks or so.
Hey, Phil, do we know if folks are together, like if folks join together, or?
Yeah, I'm not sure. It just shows a single name.
My computer just shut off. There we go. This is Shantae Gray from the Cleveland HCC. I do have Nathan Gibson with me.
Okay.
Excellent. Thank you.
Great, thanks.
Anybody else join together with other? Yeah.
Yes, good morning. This is me, Monica, from Metro Health, and Sabrina is with me.
Excellent. Thanks, Monica.
Great.
Okay.
All right, so we'll go ahead and get started. For those of us
for those of you that have been using CAREWare and are on this as a refresher, or maybe just to get some improvement tips as to how to clean your data, we've been using CAREWare in the Cleveland TGA for roughly 8 years. I want to say 8 years our system has been up and running. We've evolved with our data, I would say, significantly over the 8 years in regards to improving what goes in, how timely it goes in, and just ensuring our reports to the federal government are as best as they can be. So we use CAREWare mainly because we use it as a tracking system for our clients. We use it as a services report, so we know what clients are being served. We use it to look at time and effort for staff being paid through the different services, and then we use it for our federal reporting requirement in which the data gets uploaded to HRSA annually, and it's based on the calendar year. So we are always looking to improve our data monthly and ensure that the best data goes in as timely as possible. We also use data for a lot of extractions to give our planning council information as to questions that they may ask. So at any time they might ask, how many people are using outpatient ambulatory medical services, and what's the federal poverty level of those clients? We need to be able to extract that data from the system to be able to answer their questions so they can make funding determinations. So our planning council determines where all the funds go and how much goes into each category based on our award. So we like to be able to have the data at our fingertips so we can comply with any data requests planning council may have of us. So with that being said, we also try to make CAREWare a system that's going to benefit the grantee's office as well as the providers. So we try to look at different ways that we can always improve our data and keep on the same path of ensuring that we're projecting the best message and the best information to our federal banker, which is the Health Resources Services Administration, HRSA. So with that being said, Phil has been with us for 5 years, Phil, I want to say.
Yeah, probably going on the 6th.
6, going on the 6th year. So he's also a HRSA technical consultant for CAREWare. So we're lucky enough to have Phil as a contractor for us, and he manages a system that's beyond our technical capabilities at the program level. So we're grateful to have Phil. For those of you that know the program, we're a pretty small program. There's 4 of us, 5 of us that work in the program daily. So we really need an additional support to help us with CAREWare, and Phil helps us accomplish our data goals. So thank you for that, Phil. With that being said, we also like to ensure that folks are using the system that are the appropriate folks that have requested to use the system. So if you have access to the system, it's because you submitted a request to us and an account was established on your provider behalf. All this ties back to our contractual obligation with your funded agency. It's a very, the system can track, all usage. So it's important that we're always using CAREWare for the purposes of, inputting services and inputting information on the client, that we're never doing that phishing and so forth. So with that being said, as we've been building our system, we're going to do a CAREWare 101. We try to do this 3 times a year, roughly. We've gone away from doing it in person to doing it in a remote access because we figure we can increase the amount of times that we do it if we do it remotely. And we do have folks that are continuously being employed by the providers and staff changing. So we want to make sure that we're offering it numerous times throughout the year so new staff have the ability to learn CAREWare and meet the obligations that are identified in the contract of putting the services in CAREWare. So with that being said, I'm going to turn it over to Phil. We're going to hit a number of topics. We're going to do the general overview of CAREWare users. So anybody that's a core support or a provider that doesn't provide medical can also benefit off of this the beginning part of the training, and then we're going to do the medical portion towards the later part of the training. So we'll have an opportunity to, if you're not a medical provider, to jump off, and we'll continue with the medical portion of the training. So we're going to hit a bunch of topics. And if you want, you can also pull out your CAREWare manual and make notes in the manual as you're going through, and it will help you as we are, doing screenshots and so forth. And then we're going to hit eligibility as well. Melissa Collins from the grantee team is going to cover the electronic eligibility for the portion, and then we're going to focus a good amount of time also on just how to clean your data. So we're constantly trying to ensure that our data is clean monthly. For those of you that get those emails saying you have an error or incomplete data, we're going to make sure that we cover and ensure that you know how to clean your data monthly. With that being said, I'm going to turn it over to you, Phil.
Great. So just some housekeeping is that this session is being recorded, so for future reference, and that way you can have an opportunity to see it again, or maybe just go to a specific section that you want to review. Everyone is being muted at this point. So in the GoToMeeting invite, there should be a chat menu or a chat box. You should see the other attendees. I'd suggest that in the chat box itself, if you have any questions, just type in your message there, type in your question, and then we'll try to address those after we get done with the general overview. And if we don't get to your question today, or you didn't think about it, just keep in contact with the Ryan White program when we get done for follow-up, and we'll make sure to answer it the best we can. So when we get started here, the first thing I'm going to do is, most everyone's doing pretty well, but just so you know, a couple things with your CAREWare account. In order to keep it active, everyone should be logging into CAREWare at least on a monthly basis. If you're not doing that, if you're doing it quarterly or even longer, your account is subject to be deactivated. Because if you're not using it monthly, then there may not be a need at your agency for you to have access to CAREWare. So again, just let Melissa's group know. And then most everyone is aware you can reset your password. I wanted to demo that for you and just kind of show you how that works. Again, you do it 24/7. There's no need to email me or to contact the Ryan White office. You manage your own account. So let me just show that to you. So the first thing is, let's just say I come in and I've forgotten my password. Your account has to actually be locked out before you can reset it. So right now, there's not a little blue link that would say reset password. So I'm just going to put in an incorrect password 3 times. It could be a single number. It could be a letter. After 3 failed attempts, then CAREWare is going to automatically lock you out. So that's the first attempt. We'll do it again. That's the second. Again. Now when I try to log in for the 4th time, well, let's try it one more time. Okay, now when I try to log in, it says your account is locked from too many failed login attempts. So I click OK. Now we see that blue link, reset password. Excuse me. So here's what you want to do is, if you just keep hitting this multiple times, getting multiple tokens, CAREWare is going to think it's a fraudulent entry, that someone's trying to, it's a security risk. So CAREWare is going to lock you out for 30 minutes automatically. There's nothing I can do, and there's nothing the Ryan White office can do. So you just want to hit this link one time. I'll click reset password. Now I get this notice that the password token has been sent to my email. So you want to go to your email. There's only one email that's linked to your CAREWare account. That's typically your agency email. So here it is. Here's the token. It's just going to be a series of letters and numbers. I highlight that and I right-click and copy. Then I go back to CAREWare. I click OK here. and I enter that reset token or that code, I paste that into the box in CAREWare, and then I hit submit. I tried a little bit earlier, so let's see if maybe that was the problem with it. Yeah, we're still not getting that. Let me try with a different account. Yeah, I think what it was is that I was not logged into CAREWare officially, so let's try this one more time. Okay. So let's try the reset password. I should get the token. And we're just going to right click and copy and paste that back into CAREWare and submit. Okay. Let me show it to you again. But actually, if you click that reset password multiple times, you are going to get something like this where you're kind of in a loop, and CAREWare will just lock you out for 30 minutes. So let's see if we can get this reset. So it would take a little bit of patience. Just wait for your token to be sent to your agency email. And typically you just need the first token, and you paste that in there and you should be good to go. Let me try with this account. Okay, so the fourth time you get the notice your account is locked. That's when you see the reset password. Click on this link. The reset token has been sent. And there we go. I copy it. Right click, copy, click OK into CAREWare, and then I should reset that code. I just paste it into CAREWare, and hopefully we submit. Okay, we're still having issues with it. Let's, just in the interest of time, let's keep going on with that. That's a process. I think it has to do maybe with the remote session that we're on. And I tested it a couple times earlier, and it was working fine. The instructions for everything that we're going to cover today are in the Cleveland CAREWare manual, as Melissa mentioned earlier. So please use that as your main resource, and that'd be your first go-to for any questions you would have with CAREWare. So a couple things. I have the same permissions that most of you do, depending on if you're a support user or maybe a clinical user. And let's just look at a couple prompts that you will see, especially if you're new to CAREWare. When you go to add a client, just as a reminder, the clients at your agency are your clients. Whatever you add or added, whatever you delete or deleted. So let's just say you go to add a client here. And I'm going to add John Smith. And the way that you add the client, you want to use the data standardization that we've adopted for Cleveland. And that's where you capitalize just the first letter of the last name and the first name. Throughout CAREWare, there's going to be maybe more selections than we want you to use. And gender is an example of that. So for gender, you really only use male or female. And then the transgender, male to female or female to male. If you're choosing transgender unknown or refuse to report or unknown, that's going to skew the data, and it can cause possible duplicates in CAREWare. So I'm just going to add a male. The birth date, I'm just going to make it pretty simple. Just say January 1st of 1970. You put in all 8 digits and add client. For most of you, especially if you're a support agency, you're doing transportation or case management or emergency financial, you should see this prompt when you go to enter a client. Cleveland's a pretty mature system, and so odds are that the client should already be in CAREWare at some point. It may be several years ago, but this is totally normal. It's CAREWare trying to avoid duplicates. So it says, hey, this guy's been in the system. Is this the client you're attempting to add? So you highlight the client, then you click view more information about the selected client, and that'll bring back the latest known address and race. So from there, you can make a determination, say, yeah, that looks like the guy. I've got a different address, but I can always update that in CAREWare. So in this scenario, if there was more than one client that was listed, you could go back to the list. Here, there's only one. But about 99% of the time, you want to use this middle selection. This is the client I was attempting to add, and then you go to the client screen. Please do not use this one. The client's not on the list. Create a new record. That's what causes the duplicates. So just again, check your intake carefully. Make sure that you enter the client's first name, last name correctly. You're verifying with a federal, state, or local ID that the client is who they say they are. You're not using a nickname or estimating the date of birth. So in this case, I would just say, yes, that's the client I was attempting to add. And it should take me right to that client record. Okay. There's also another scenario you might see. Let's say I was going to add the same client. And again, I'm sticking with the standard data entry, capitalizing just the first letters of the first and last name. But let's just say that in the gender, I accidentally grabbed female, selected female instead of male. And let's see what kind of a prompt we get on that. I add client. Now see, this is a different layout, but again, it's just notifying you of a duplicate. So what it's saying, the upper part is the client that you wanted to add. So CAREWare is saying, are you sure you want to add a John Smith, gender female, when you already have a John Smith as a male at your agency? It's not just in CAREWare somewhere, it's specifically at your agency. So in this case, again, you don't want to add a new client because that'll create a duplicate. You want to highlight the client that you're interested in or that you want to go to, and then click Go to Client Screen. And that should take you right to the same client record. Okay, so just a couple prompts to keep the duplicates down. Again, just verify your information. You should never be estimating the date of birth. So if you check this off, that's going to come up as a data flag, and that'll be caught in the missing data report. So we're going to talk about that in a little bit. So let's just go through some of these. I'm going to also show what it looks like to add a brand new client. So let's just say I'm going to add John Smith, but this time the first name is going to be spelled Jon. And let me give it a little different birth date. I'm going to go ahead and just add this as a new client just so you can kind of see what that looks like. Okay, typically if you have a brand new record, nothing's going to be filled in. In CAREWare, this whole demographics tab, we're going to look at demographics, services, and annual review. Then we're also going to be looking at the electronic eligibility portion, the attachments. And then for medical sites, we're just going to go back and review the encounters, which is where all the clinical information would be inputted. But for now, all this information is required. So for instance, if I try to go to the service tab and enter a service right now, I'm going to get this. So CAREWare is going to let you know of all the data requirements that are not met. We're going to go through these and fill them in. But you won't be able to go further to annual review or services until the demographics are completed. We've already talked a little bit about the gender. We're just going to ask you to use the first two, male or female, and then the two transgender classifications, M to F or female to male. Let's keep this as a male. Okay, the sex of birth, pretty explanatory, self-explanatory, male or female. I want to show you what happens when you change names for a client. CAREWare takes the first and the third letters from the first name and the last name, and it takes the 6 digits out of the date of birth to make this unique ID. So we see here we have J and the N, the S and the I, and then the birth date 01/01/90. The 1 at the end just means that it's a male, a 2 indicates female, and the 4 and the 5s of the transgender classification. So it's going to make a difference. If John is spelled John, it's not going to change this unique ID too much, but it is going to change the encrypted. So let's see if I change that. Yeah, CAREWare is going to, it'll change this a little bit. But the whole idea is that you should edit the record with whatever changes the client has. If they change their last name, you just want to make it say it's not John Smith anymore, it's John Lewis. You just want to update this record. What you don't want to do is create duplicate records. So if their gender was male and now it's transgender, you just want to go to the current record and make the changes. You do not want to create a duplicate and then we get into the situation where we have to merge them and we have duplicate records floating around. And you'll see that once we get all the rest of these fields filled in for the requirements, then you'll be able to see how a good example of that. So for the street address, you're just going to put in, again, just using, let me just say we're 150 West Main. We want to use the same sort of configuration. Just capitalize just the first letter out of the directions. You don't need, as a general rule, you don't need punctuation or spaces in CAREWare. We try to have you mirror however the address is listed with the Postal Service. So maybe this is an apartment number 7. Maybe it's a unit. So whatever the classification is for their address, we just ask you to use that. The city, again, the same thing. Just capitalize just the first letter. As soon as you choose the state, the counties are going to automatically populate for you. And we do want you to, of course, fill all these in. So let's just say we're going to be in Cuyahoga County. For the zip code, let's see, you can go ahead and use the 9 digits. CAREWare will now take that even with a dash. But really my suggestion is just stay with the 5. That's more than adequate for what we're doing. The phone number here, even though it's not required, just be aware that there are several types of phones that you can designate. So it might be their home phone, might be their mobile, work, or a fax. So you pretty much put maybe the primary contact in here. And then be aware there's also a sub-tab here. Here's the main address that's linked to the record with CAREWare. There's also a mailing address. So we'll see if I can get over to that. Yeah, it looks like it's not flipping over there. It might just be with the permissions that I have set. But if you use the sub-tab, there'll be alternate places for maybe a mailing address and also 2 other phone numbers that you can designate and put in there as well. So just be aware there's other places for alternate addresses and phone numbers. And let me just skip right back up here, the client ID. This is optional. This could be your EMR number or your client record number. It's just for internal use at your agency. If you want to use it, great. If you use, I wouldn't recommend putting the whole Social Security number in here, but maybe the last four if that's part of your record keeping. All right, let's skip down to the race and ethnicity. Now, these are considered different and completely independent fields. So the first thing you need to do is designate the race. And the way you designate multiracial is you choose more than one race, and then it's automatically coded that way. So you can choose it as many that apply. Just be aware that for some of these races, you may be required to put a subgroup in. So for instance, let's say we have white and Asian. As soon as I tab out of here, CAREWare is also going to prompt me for the Asian subgroup. And for now, I'm just going to keep that blank just so we can see the data check on that. So again, especially if maybe you have Hispanic clients, they're still going to need to identify with a race over here. It may not be the best selection. You might just have to choose white, since there's not really any other selections. There's not an unknown or another category. And then same with ethnicity. You're just going to have non-Hispanic and Hispanic, and be aware if it is Hispanic, to also choose a subgroup on that. And for this demonstration, I'm just going to put it as non. Okay, let's look at this box on the far right-hand side at the top, enrollment status, enrollment date. So the first thing is when I get a new client, it'll automatically come up as active. And then you want to put in the enrollment date. The enrollment date is a one and done. Let's just use today's date. So this should be the first date that you see the client, the first time they've come in or you completed the intake in person with them. It really shouldn't be the date of their appointment. It should be the first time you ever had contact at your agency. This might be 10 years ago, it might be a couple years ago, or very recent. So it's a one and done, regardless of what happens to this client. If they fall in and out of care, maybe they relocate for a while, then they come back to Ohio. If they're still eligible, you just adjust the enrollment status accordingly. So anytime that typically they're going to be active, but then maybe they relocate, they go down south for a while, for a few months. What you would want to do is you would want to recode their enrollment status as relocated, and then also put in a case close date. Then let's say it's a few months later, they're back in Cleveland for services, they're still eligible. All you want to do is just reactivate them, just change their status back to active. The case close date's going to fall off and get grayed out. And then you just go on with services. Just as what I'm seeing with monitoring the data quality, I do see with some agencies that maybe it's been a few years since they received services, so now they're back in town, but you still have this coded as referred or discharged. So just double check if you're providing services for your clients, they should be active status. And let's look at the vital status real quick. Pretty straightforward, mostly alive or deceased. And again, we're trying to stay away from using unknowns and unreported in CAREWare. If you do have a client that is deceased in the reporting year, it's also going to be required to put in the date of death. You put that in at this field. And you would think that the enrollment status would automatically change to referred or discharged. It doesn't. You'd have to manually do that. And the selection you want to use is referred or discharged for a deceased client. Removed is if they're no longer eligible for services. They're either, it's mostly for disciplinary reasons at your agency. Maybe they were hostile. Maybe they were a threat to themselves or someone else. So removed actually means that you're saying that you're not eligible to get services here. So for deceased, you just want to use the referred or discharged, and again, put the case close date in there, which may be the same as date of death. There might be some non-face-to-face follow-up as well, and that's fine. All right, let's clear out this. We'll just put it back to active. And let's look at that Ryan White eligibility. And this seems to be a little bit of confusion with this. When you first add a client, they're not going to be eligible for Ryan White. You need to tell CAREWare that yes, they are eligible on this day. So this is a date span, very similar to their medical insurance. So it's eligible on a certain date, and then on another date, maybe a year, they're not eligible any longer unless they renew it. So you can't change this field directly. You click on the eligibility history. That'll bring up the eligibility history box. You'll click on add record. We'll just use today's date. And then we're going to pull down the funding source. So some agencies, you're just funded for the Part A, and you're not going to have a list like this. And that's fine. Other agencies, you might be funded for Medicare, Medicaid, Part C. So this is just an example. You just choose whatever funding source applies, and I'll just choose Part A. And we'll click as eligibility, yes, and save. So as soon as I choose that and I hit close, then you'll see the eligibility status automatically changes to Ryan White eligible. This field, this is one section in CAREWare that should be used when you're doing your first initial Ryan White certifications, when you do the original Ryan White application. You should also be using this each time that you do your recertifications every 6 months. So that, let's just say we certified today, and then 6 months down the road, so in April or May, I should add another record that yes, now we're at April 2019, the client is still eligible for Part A. You don't want to just change this single record. You want to have multiple records. If I just edit this in April of 19, essentially all the services that I did previously are not going to be counted as if they didn't exist. So you don't just change a single date to match the recert. You actually add another record on when you did the recertification. Okay. And Melissa, you might just monitor the chat box too. If I happen to miss any questions that come up, we make sure to address those.
Okay.
Thanks. Okay, then we just have a couple more sections left on HIV status. Of course, the client has to be positive in order to receive Ryan White services. So they're pretty much going to be HIV positive, not AIDS, or positive AIDS status unknown, or CDC defined AIDS. There should be any affected within the TGA, and indeterminate, those would have to do mostly with infants, and there shouldn't be any of those clients. So it's pretty much going to be the first three: positive, either not AIDS, or the AIDS status is unknown, or AIDS. And be aware, depending on what your status is, you're also going to be required to put in a HIV positive date and an AIDS date. And you see this yellow triangle popped up in CAREWare. Anytime you might see a yellow triangle, you'll see maybe a red circle with an exclamation point. It's an indication that you need more information. There's either a data mismatch or there's more information that's required in CAREWare. So if you hover your mouse over the triangle, you'll see here it says not entering a value could affect accuracy. It's just saying an HIV date is required. In this case, it is okay to just put an estimate. Maybe the client says, it's been several years ago. It was January of 2008. That's fine. You can just start putting your date in here. And you can click estimated. That's all right. Now, if it is AIDS, then same thing. You'll also want to put in the AIDS date. This is usually a more defined date. It's a specific diagnosis on a specific date. So this is usually easier to get, but also make sure to fill that in there. You can estimate if you need to, but typically you wouldn't need to. And then finally, to finish off with the risk factors, you just choose all that would apply. I'll give you HRSA's definition. This isn't necessarily what their mode of transmission was, be it, receipt of transfusion or perinatal. It typically is what risky behaviors are they involved with now, currently, to either themselves or others. If you want to use also the original mode of transmission, that's fine, you can. But this is, just keep in mind that CAREWare is a snapshot of what happened in that reporting period, and it's likely to change. So it's kind of what currently is going on with that client. Maybe it's MSM and injection drug use. If the policy at your agency is to use both the mode of transmission and current risk behaviors, that's fine as well. You just choose as many that would apply. And again, we ask you not to use the not reported or not identified, and try to see if it can be reassigned to another selection up here. Okay, so that does it for the demographics tab. Now again, remember, I'm not going to be able to go forward and put a service or annual review in unless this is complete. So let's just check to see. I'll try to click on service. And it says, nope, not quite. I need to have the Asian subgroup. So at this point, I would just confirm that, yeah, is the client white and Asian? And if that is true, then go ahead and choose a subgroup for the Asian category. And then I should be good to go forward. Okay, so I can go and we're going to look at the services next. I did want to show you on the names. So let's just say I've got John Smith. Okay, so here's a unique ID. Here's the encrypted URN. We see that starts off with C like Charlie, 50. As soon as I change the last name, or I'm sorry, the first name, if I make it John with an H, you'll see it's not going to change the unique ID that much, but the encrypted is going to be totally different. And why this is important is because this number here, we call it the EURN, or the encrypted URN number. This is how the client is actually tracked throughout CAREWare. There's only one record in CAREWare, but CAREWare knows to parse it out if a client happens to be going to more than one agency. So I say all that just so that you know that please do not, especially when you're adding a client, that's where most of the duplicates come from. Be very careful on your intake information. And then if you do have a client that changes their name down the road, let's say we have, this becomes now Smith Lewis, that's fine. That's not really going to change anything because it's after the third letter, and the date of birth hasn't changed, the gender hasn't changed. So that's not going to change. But if you have a complete name change, maybe it's John Lewis, that is going to change it. So the unique ID is going to change slightly, because again, we have the J and the H out of John, and the L and the W out of Lewis, but this encrypted URN is completely different. So what you want to do is just edit the current record. You don't want to get in the scenario where you have duplicate clients at your agency. And let me show you this real quick. Sometimes I think users are reluctant to actually delete a client. Let's just say I'm checking to see if there's a John Smith. Which you really shouldn't be doing. You should be putting it in there as if you use the standard data entry, as if it's going to be a permanent record. And let's say I put them in here as 1950. Okay, if you accidentally add a client at your agency, be aware that you can delete that client as well. If there's no services or no annual review, all you have to do, if you say, whoops, this looks like a duplicate client, I didn't want to put him in there, you just click here, delete client, and click yes. If the client already had some services, let me show you John Smith here. If the client already has some services in there and some annual review, you still can delete the client. Not that you probably want to, but you would just go through the same thing, delete client. And now, because there's so many records, CAREWare is going to say, are you sure you want to do it? They have all these previous records filled in. If you say okay, you still have to physically type delete in here. So there's really not a way that you can accidentally delete a client. But again, your clients are your clients. You add them as you add them, and you delete them as as fit, what's applicable.
If I could just make one comment with that. If
Sure.
services have been charged for a claim and already billed to our office,
Yep.
nothing should be deleted. You should be contacting our office to figure out maybe next steps if there was an error or so forth. But as long as services have been billed, there needs to be some conversations between yourselves and ourselves.
Exactly. Yep. Yes, that's a good comment. So Melissa's just verifying that, and especially if it's related to data deficiencies, that you shouldn't be deleting services just so you can be compliant, so that to clean up your data. And you never really want to delete these annual reviews, which we're going to talk about in just a minute, because this is what's considered common data. So it's not just at your agency, but these values are also can be used by other agencies if they are serving the same client. And the whatever is entered in the annual review, that's not going to impact your data deficiencies. It's not going to cause a deficiency. If you don't have something in there, then yes, it's going to cause it, but you should never be deleting these values regardless. Okay, let me just show you a couple of quick ways that you can find your clients. And then we're going to continue on with the services and the annual review. So a couple of ways. Typically, once your clients are added, you just enter the first couple letters of the first or the last name. So again, maybe I'm looking at John Smith. I put in a couple letters, and then the record's going to come up. Because we've already looked at the unique ID, the date of birth is actually encoded into this. So you see here we've got the 0170 for the date of birth. So you can also look up clients by the date of birth. And the way you would do that is when you get to your Find Client screen, in the unique ID is where you put the 6 digits of the date of birth. And that'll bring back everybody with that date of birth. So if you have an EMR or an existing database, this might help. I use this quite a bit as sort of a shortcut to look clients up. And then finally, you can put what's called a wildcard on your keyboard. If you hit the Shift key and the number 8, it'll put an asterisk or a wildcard. If you put that in the last name field and then click Search, that'll bring back your entire client roster. Again, this is just a fictitious database just to test clients. It doesn't mean that all these clients are active or that they've even received services, but it might be just a way that you can see your whole client list. All right, let me just go ahead and I'm going to go back and pull up John Smith. And we've already covered the demographics. Here's your mailing address. So here's your street, an alternate street. If you wanted a mailing address for that, you have an alternate phone and different phone types that you can choose as well. All right, the services, those are all preloaded for you. You don't need to worry about those. But let's just take a look at a couple examples. So the way to get this started, you click on New Service. CAREWare automatically opens up to today's date. If you wanted to go back to the previous week or the first of the month, you certainly can. But again, be aware of what your budget is, particularly if you're multi-funded for Part A, and maybe you get MAI funds as well. Just make sure there's still funds available. So you choose the date, then you choose the service name, and your drop-down is probably going to look a lot different than this. I'll just go ahead and choose one here. Maybe we've got a new EIS out of care. And then if you're not aware already, you will be soon as far as the program side of what these units of service mean. So a unit of case management is much different than medical, than a parking ticket or a bus pass or food. So typically every 15 minutes is considered a unit. So if you do an intake with a client and you're with them for 2 hours, you actually want to put in 8 here. So it'd be 8 units. There shouldn't be any 0.25s 0.5, that's not how you would do it if you're only with them for 15 minutes. If you spent half an hour, you would want to put in 2 as far as your units go here, and then save that. So that's just a standard. At any time, if you say, oh, that I spent 2 hours with them, I should change the units, you can edit the service. You just highlight the service you want to edit, and then you can change whatever you need to. Okay, let's save that. Let's look at another subservice where maybe there might be multiple contracts involved. Let's see. Yeah, I think we have these pretty well defined. So again, your drop-down list is going to vary. In this case, if I choose this outpatient ambulatory health services labs, that links up directly just to the Part A contract. If I were to choose this MAI primary care visit, then that should automatically link up to the MAI contract. And there again, depending on what kind of a visit it is, mostly these indicate their salaried positions. So from the units that you put down here is how it's determined as how much time was actually taken. So if this is a visit, Melissa, correct me, are they changing that with the RN visits, or is that just one unit and it's done?
It's still 1 unit for 15 minutes. And so what we ask for is that staff that are paid for by FTEs, you need to have at least half of your time that's being billed to us documented in CAREWare.
Okay, great. So if they were with the client for an hour and a half, they really should be putting 6 units in there, even
Absolutely.
though there's not a cost associated with it, so we can figure out the time that the staff spent.
Absolutely. We use it as time and effort. So your time has to be documented in CAREWare. And we will contact you if you're below that threshold of that half of time that you're billing us for.
Okay, perfect. Thanks. Okay, so that's pretty much your services. Again, it's the same thing. If you accidentally add one in here and you say, oh, whoops, it shouldn't have been in for this client, then you can delete it just like you would editing the client records themselves. So you just say, whoops, that shouldn't have been in there. I'm going to delete that just because it was incorrect, not because I'm trying to clean my data. So let's just look at everything in CAREWare is on a reporting year, which is the calendar year. So right now we're in the final quarter, getting ready for the Ryan White Services report, the annual report for 2018. So we're way past mid-year. So the next section that we're going to cover, nobody should not have reported income, insurance, or housing. Even in your clinical folks, there shouldn't be anybody that hasn't already come in for especially CD4 and viral loads, but they should have had most of their annual screenings up to this point. So what CAREWare does is if there's any service for the reporting year, so 2017, 2016, those, we're not looking at those. Those are past, they're already reported. So CAREWare just looks at the first service for the year. Let's just say this was in June. Then we're going to flip over to the annual review section. So regardless of what entries are here, CAREWare is saying as soon as you have a service in the reporting year, it says, okay, now I need insurance, I need income, and I need housing. If it's a medical service within the year, then CAREWare says in addition to all these, which is the basic annual review is insurance, income, and housing, I'm also going to need all the screenings. I need to respond to, have they had risk counseling for the year? Have they had a mental health screening? And have they had a substance abuse screening? In addition to all the clinical indicators, CD4, viral load, cholesterols, STDs, and STI screenings. So that's the logic behind CAREWare. You see here, if if I'm looking at this as a medical site, that the insurance, the income, and the housing are all reported in 2018. So that's fine. You're compliant there. But all of these are back in 2017. They're annual screenings, and they're required to be updated each year. If at all possible, it's best if you can update this at the time of the service. So for instance here, it looks like they came in for labs in June. You would expect that the risk reduction was also done at the same time in the mental health and substance abuse screenings. If it's not done at this time, maybe in the next 3 months it should be complete. But there shouldn't be a scenario where we're almost to the end of the year and the annual screenings for your medical folks are not entered in CAREWare for the current reporting year. All right, let's take a quick.
One other comment on that. So I recently did a data request for planning council, and it was in regards to substance abuse. And a couple of clients that were in substance abuse here last year, when I looked up their going client by client data mining, it was indicated that they were not nicely indicated for substance abuse this current year. I don't know how that would be, so I would also just ensure that the data makes sense that's being put into CAREWare. But to me, that does not make sense. Right, so if they're in mental health services, it should not say not medically indicated.
Yep.
For the mental health.
So if we can, let's just go ahead and we'll finish off on the data entry. But let me cover each of these fields in depth here. So there's a couple ways to add the insurance. The first is just to hover your mouse inside the box until the plus sign appears. Then you click on the plus sign. And then you're going to get the insurance assessment box. So when you're assigning the primary insurance, I strongly advise that you don't just use the check boxes to do that, because CAREWare might reverse the order as far as the primary and secondary insurance, or what CAREWare calls the other insurance. So when you're choosing the primary insurance, please select from the drop-down menu. Don't use just the check boxes. And the other thing that I've seen is that for whatever reason, sometimes I see where people are choosing other, and then in the other box, they're typing like Medicaid or private insurance. So they're saying something like ACA. Please use especially for the primary insurance, if there's already an insurance that's listed here, please just use that. Don't write it in on the other. And I've even seen where sometimes if maybe they're getting insurance through through your state or ACA, what you want to do is choose private individual, and then under other you can put down maybe it's United Healthcare if that's helpful for you internally. You don't need to specify what insurance they have, what insurance company, and unfortunately you can't search for this later. So there wouldn't be a way that we could search for all your clients that had United Healthcare as other. But if it helps you for a particular client, you can definitely put it down there. So again, when you're choosing the primary insurance, please use the drop-down box only. And let's say they have Medicare and Medicaid. Maybe the Medicaid is primary, and then the Medicare would be secondary. So that would be the way that you want to enter it. You wouldn't want to put something else in here. Maybe just say that they've got Medicare or Part B or something else. And then just as a reminder, I think most everyone is aware, but Ryan White is not insurance. So we don't want to be seeing any of this in other Ryan White or RW. If they're dependent on Ryan White for the insurance, they basically have no insurance. And yes, since Ryan White is not an insurance plan. All right, let's look at the income. There's two components that are required here. You're going to need the income and then the household size. And CAREWare is going to automatically calculate the federal poverty level. Let's just say that I accidentally reverse the 2 here. Let's just say their household was 2 and their income was 12,000. So I'm purposely reversing these so the income is only listed as 2, which CAREWare is going to think is $2, and then we have 12,000 folks in the household size. CAREWare will actually take that, and you'll see later we're going to have to look at some custom reports to actually get this flag so we can make the correction. But again, there are 2 ways to enter the data. You can hover your mouse over the box and click on the plus sign, or you can hover your mouse over the field that you're interested in and go over to the right-hand side and click Add. That's another way to put a record in there. So the basic annual review, again, there's only 3 sections: insurance, income, and housing. Let's do the same with housing. For those of you who've been using CAREWare for a little while, they finally cleaned this up, so there's only the 3 active selections. It's either going to be stable, temporary, or unstable. You just make your selection there and hit save. Okay, then for the medical, again, it works the same way. You just hover your mouse over here, or you could, if you're interested in the risk reduction, you'd go over here to annual screening, up to the top and click Add, and then you'd have to choose the type of screening. Maybe it's risk reduction, and then whatever the result is. If it's yes, and you save that, then you can see it's recorded 2018, so now I only have mental health and substance abuse to finish this off, so it's complete. If there happen to be values in here from the previous year, let me just kind of give you an example of what that would look like. Let's just wipe out this insurance. Okay, you might run into a situation like this where maybe this insurance was just verified last year. Maybe you did it December of 2017. But remember, CAREWare works on a calendar year, so even if you updated it very recently, but last year, it has to be 2018 because the service was delivered in 2018. So you might be able to use this Bring Forward button. If these values haven't changed, if they're the same, you can click on Bring Forward, and then CAREWare may let you bring forward these values depending on what they are or how old they are. So let's just say that this is still accurate. They still don't have insurance. We're here at October 25th, and I would hit Save. So it's kind of a shortcut for you. Don't rely on it for just automatically clicking on it without verifying the information first. So that's the annual review. Now let's go ahead and we're going to look at the electronic eligibility as well. This section should also be used with the electronic eligibility when you're doing your initial certifications and also on your recertifications. So there's going to be 3 sections of CAREWare when you do a recert or when you certify for Ryan White. The first we saw was on the demographics tab, where you want to add a record on each time that you do a recertification. Let's just say I was doing a recertification today. You see that we have a date span in here. What I don't want to do is just highlight an existing one and put today's date and say that they're eligible. That's going to skew the data and could possibly make it so you're underreporting and you're not getting full credit on the RSR. So what I would do is I'd actually add a record here, and I'd say as of today, yep, they're still eligible for Part A, yes, and save. Okay, then I'd make sure that under my annual review that all of these were updated for the date that I was doing the research, and especially the insurance, income, and housing. That's the basic part of the recertification. And then the third section of CAREWare is going to be under the attachments. Let's click here. You haven't seen these yet in your agencies. This is something we're thinking of adopting a couple custom fields where you would just be able to confirm that yes, all the Ryan White eligibility components were confirmed, and then you put in a date on when that happened. So again, we might roll that out the first of the year, We're not really sure exactly what the setup, but just be aware that we're thinking on ways to help you, reminders to make sure the data is complete. So we're on the attachment tabs. There's 5 sub-tabs, if you will, or 5 sections where you need to update your electronic eligibility. For this, I might refer to Melissa Collins. Do you want to jump in and go through this, or would you like me to actually show them the attachments themselves and the uploading, and then you can take it from there?
I don't know what would be easier.
I have some
I don't know if you...
are set. If you want, I can just run through the actual upload and then just...
Yeah, say if you already have samples and stuff, it might be easier if you do that, and then I'll jump in and see.
Sounds great.
Say, mistakes I'm seeing quite often.
Sure thing.
Okay.
So let's look at the eligibility application. This would include your initial application and certification, as well as the research. So what you do, you click on the sub-tab, then you click Attach New File. And then I'm not exactly sure how things are organized at your agency. What I would recommend is that you probably have a folder that's called Attachments or Electronic Eligibility or something of that nature, because you want to keep backups on everything that you upload. So in this case, I just have a demonstration, and then I also have a separate folder for each client. If you've got thousands of clients, that might not be workable, but there should be some way that you know what you're uploading, that it matches the correct client record, and that you're not uploading somebody else's record to incorrectly. So here I have just a test client, and then I have my eligibility application. Melissa's going to let you know there's a specific designation on what that file name, what to call that file and how to name it. So in this case, it's going to be the initial application. Let me click here, double click it. You choose the content type. This isn't that critical, but if you can just match up, you see at the end here, the type of file is what they call a PDF. So typically match that content up with the file that's uploaded and hit save. Let me expand this so you can see that's just the location of that file before I uploaded it. So this is another opportunity that if I have the client's name in there and I'm working, with Carol Smith, that I don't want to upload John Smith to her record. Then I click Upload Files, and then it's uploaded. I highlight it and I click View. And I'm just verifying that, for one, that it's readable, that it's not, all blacked out, that maybe I scanned the backside of it and I'm not really getting any content. So I'd actually suggest a couple of things. In your initial source files, let me go to wherever you're keeping these folders at your agency. Maybe it's on your computer, maybe it's on a shared drive. When you're first scanning these, you should be looking to make sure that they're readable. So that even before you upload them into CAREWare, if you know that you're going to upload the application and the status, you have a recert, verify that these are readable at the source file in your computer first. You may have to rescan them. Maybe there was an issue with the scanner. You might have to get your IT to help you out with it. But please check these before even uploading them to CAREWare, just to make sure that they are what you think they are and that they're readable. We've had several uploads where the documents are really unusable. It's a waste of agency time. It's a waste of monitoring time, because these documents are used in a lot of different ways to verify the research and the Ryan White eligibility. So if you're taking the time to upload, please make sure that your documents are readable and usable. Okay, so let's just continue on with the rest of the sub-tabs. So here I just uploaded a application. I would do the same thing with a recert. I would attach new file. And let's say here's my 6-month recertification, no change. So I would upload that. It's going to be a PDF. Save. And let me upload that. And again, if you extra precaution, if you want to just make sure and view it here, if you have several of these, I can understand you don't want to check it twice, but at least please just check it once. And make sure that you're uploading the appropriate document to the correct subtab. So here's residency. So let me click over to proof of residency, upload that file. Just make sure it's visible. And I might as well just complete this. So we'll get the proof of income in there.
Since you're on the proof of income, can I just jump in really quick?
Of course.
Even if a client has no income, there's something needs to be uploaded for every single tab. So what I'm seeing is in some cases a client doesn't have income or they don't have insurance currently. You still need to upload something documenting that. I'm not sure what your agency policy internally is. If you have a no income form that they're signing, then upload that. Or if you're trying to access the CRIS system and looking up their Medicaid status and it says that they're ineligible, then upload that as far as proof of no insurance. If you're putting in a new application for that reassessment, then something needs to be uploaded for each of those tabs. The only time you don't upload something for every single tab, obviously minus the diagnosis tab, would be the 6-month no change because there's been no change.
Great. Okay,
and then just to reiterate too, then real quick because you're clicking on the status, HIV status, their diagnosis doesn't change. Once the person's diagnosed, they're diagnosed. So there's no need to upload a proof of diagnosis every 6 months. That's kind of a one and done thing. So I'm seeing some agencies every 6 months they're uploading proof of diagnosis, and it's not necessary.
So the only time that would change then, Melissa, is if it progressed to AIDS or if there's a change in the status to that?
I don't think that we even said that. You change that in the demographics page.
Right.
And that would change, we would see that when we'd monitor their EMRs. But once somebody's diagnosed with HIV, they're not gonna go backwards.
Okay.
I think some people are thinking it as like kind of when people used to request labs of every 6 months. That's not where you're documenting their updated labs.
Okay. And how about for insurance? Do you have any instructions as far as that goes, or what you're seeing on your side?
Aside from there are some documents that are not legible. Hold on a second. There's something in the chat box.
Yep.
Hold on. There's a couple in the chat box.
Okay. And we're getting pretty close to questions, so.
Nope, this is actually for insurance. If a client has no insurance, we need to have something that says that they have no insurance. I think, you have to have something that says that there's no insurance. What I've seen some case managers do is they type up something that, due to immigration status or this client has no insurance and is ineligible. Or, some case managers have actually accessed the county system that shows that they've applied for Medicaid and that they're not eligible. So they just print that screen and they upload it. And it says with regards to income.
Okay.
And then initially is told by Molly if a client does not have income. I'm not sure. So Molly hasn't been with us for a few years now, but according to all of our eligibility policies and everything, and our trainings that we've had last December and others, we've gone over this, that something needs to be uploaded for every single tab, that there needs to be documentation of no income as well as no insurance. And
Are you
it
talking
has
about
to be
the 6
noted on
months
the
no
application.
change, though? Melissa, I'm wondering if she's talking about the 6 month no change.
I don't know. Yeah, with 6 months no change, there's nothing that's uploaded.
Yeah.
I think also to piggyback off that, if you're using, we'll say, their explanation of benefits for Social Security, their proof of income, if you upload that under income, we also, and their address is on it, and you're using it for income and residency, it needs to be uploaded in residency as well as income to prove both.
And if there's other questions, we can unmute them too when we get done with this last section before we get to the missing data.
Okay. Sounds good.
So again, there's the 5 sub-tabs for electronic eligibility. And if everything is filled in correctly, what you should see, especially on a recert, you may not have to upload a HIV status again. But if this was a real recert, and this is on 10/25, I should see October 25th in 2 other places. So not only is it under the attachments, I should also see that the insurance income and housing was updated on that same date. And then finally, don't forget to update your Ryan White eligibility. Even though it says eligible, you want to click on the eligible here and make sure that you've added a record for the same date that you did the recert. So 3 different spots in CAREWare for a complete recertification or the initial certification for Ryan White. I was just going to hit the clinical real quick here. Is that all right, Melissa? So we have a number of clinical sites that are on the call.
Yep. Do you want to do clinical first and then not the data cleaning?
Yeah.
Okay.
And then maybe we'll just see if
Or do you want me to jump?
Yep, go ahead.
I was going to say, do you want me to just jump in just in case anybody's jumping off? Just a couple other notes on eligibility that I'm seeing in CAREWare.
Absolutely.
Well, nobody should be jumping off because we're going to be doing the missing data.
Ah, okay.
Yeah.
Well, never mind then.
If you guys would prefer, I can just do the clinical after we get done with the missing data and the summary reports as well.
Okay.
Just real quick for the clinical, this is the other tab, and what's required. So we know that you have other systems, either in your clinic or you have other EMRs. So we don't need the vital signs and the ER admissions. That's something you should be collecting probably internally. The only thing that's going to be required is the ARV medications, the labs, screenings. We're down to a couple vaccines or immunizations now. And that would be it. So it's a short list for the medications. I send out a notice when I update the new ARV medications. And hopefully your primary contact at your clinic is receiving those so that you're aware of the new drugs that are available and added to CAREWare. So to add a medication, you click on the sub-tab. So in this case, I'm on medications. I click rapid entry, and then I would hit start. Let's just say that this is a newer one, and we've got them on, let's see here, what are our newer ones that we added? Let's say this one, we're on Sympholo. So I would highlight the medication that they're on and click next. The units, this would be, is it a monthly supply? Is it a 3-month supply? You just put in the number that would be. The form, typically they're capsules, but whatever the medication form is, solution, suspension. These aren't really all that critical. So the strength, the way it's set up to work in CAREWare, you can maybe say it's a 10 milligram, and the frequency is going to be once a day. Those aren't really that critical. If you want to just put in one for all these units, we don't really use these as such. You just put in one for unit, one for strength, etc. But the indication is important. So under the ART, why is it being prescribed as an ART, or is it being prescribed as a opportunistic infection, maybe for prophylaxis? So if that's the case, then you might have to also select the OI field. I think really the only one there that HRSA is interested in recording now and collecting is the PCP. And then you would just finish, and then that's going to be part of their permanent record. This is just like the services. At any time, if you need to make a change, or say that they're, for whatever reason, they're stopped the previous drug, they're stopped, Complera, and they're out on this drug, then you'd also want to enter a stop date for this medication. And you would just choose which one it is and a stop date. You can put in a reason. Maybe there was interference or intolerance, and hit save. Okay. And then if there's any changes to this, maybe if it wasn't for opportunistic infection, you can highlight the medication you want to change, hit zoom and correct, and then you go back and make any changes that you need to. So maybe this is just as an ART, and you don't even need an OI response. And it's pretty much the same with all the rest of them. Labs is the same way. You click on labs. The format's a little bit different, but to get this going, you click on a rapid entry. It'll show the last date within the last year of any previous screenings or labs. So we'll click rapid entry, and you click add, and you can either type in CD4, today's date, or whatever date it is, and then the result, and save. And you do the same thing with viral load. The screening labs, again, is kind of a short list, but HRSA is requiring that we also get information on the sexually transmitted diseases and infections. So all the STDs and STIs are required annual screening. So you want to make sure that those are up to date. And then finally the same with the distinction here, the difference between screening labs and screenings is typically a screening lab is going to involve a blood draw, where the screenings may not be a blood draw. So maybe it's a skin test, TB skin test. If their pregnancy status, if that is applicable or not. And then finally with immunizations, and mostly HRSA is trying to collect the information for the Hep A's and the Hep B's, as well as maybe the influenza. That's only required certain times during the year. So same sort of thing, you'd click on the rapid entry and click add, and you choose whatever the vaccine is. Maybe it's the first of the Hep B series. Oh, and let's put the date in there. And they received it, and then what the results were. They call it immunity. So those are the tabs. If just a quick kind of a shortcut for your medical providers, instead of going to each of these sub-tabs, you could do a create encounter. And let me make this for a previous date so we don't run into issues. You could create an encounter. And it's the same way. It's just that it's kind of a shortcut for you, so that, for instance, in medications, I could just start right away. I could click start and enter my drug here. I could flip over to labs, and I could say, okay, I already have a CD4 in there, but let me put in a viral load. So if that's easier for you and you prefer to work with this as a kind of a shortcut, creating an encounter, feel free to do that. Either way, it gets you the same information gets inputted into CAREWare. And you see here that if you do it as an encounter, CAREWare knows you're putting clinical information in there. It's saying, hey, do you also want to put in a care visit, a medical visit at the same time? So either yes or no. Maybe you did labs on that same day, or there was a nurse visit. So that's just a reminder for you. So that's pretty much it for the section we wanted to cover on data entry. The next section is going to be, we're probably going to take most of our time, is to look in depth at the missing data reports and what you should be doing monthly to clean up your data and maintain clean data at your agency. Do we want to take any questions just on the demographics or the data entry portion to this point?
I think we should.
Okay. And again, you can feel free to use your chat box. Let's see, I don't think they have a raise your hand, but I can certainly unmute your line if you would like to just ask a question over the phone here.
And maybe type your name in the chat box if you want to ask a question.
Yeah, that'd be great. So any questions at all, either on the demographics, services, annual review. If you want to review any fields in CAREWare, you have a question on how to enter it. Okay, and if you think of something, we'll still monitor that throughout the rest of the call. Maybe we can address it at the end, or we'll follow up with you directly. All right, so let's assume at this point that all of our data is in. So now we're going to start looking at the data quality. And the process that I'm going over right now is something that each agency should be doing and cleaning on a monthly basis. It's not every quarter. It's not every 6 months. It's not just at the end of the year for the RSR. There's certain minimum data requirements that should be cleaned up every single month before you submit the invoice to the county. So to begin with, we're going to look at reports. And we're going to click on the financial report. And for the billing, that's a little bit different. I'm going to cover that at the end of this. But if you think of most of your reports, it's cumulative throughout the year. So we want to see how you're doing throughout the entire year. So I'm going to run for 2018. Make sure that's selected in your date selection. I'm on the financial report, and we're just going to run the report. And what this is going to do is it's going to give me an aggregate. Of course, it's just a small sample set, but it's going to give me a unduplicated client count within each of these funded categories. So this can also be a check to you that, let's say you're funded for 5 service categories throughout the year. Well, if you only have data on 4, you need to look into why aren't you providing delivering services for that other category? And maybe you need to contact the Ryan White program. Maybe there's a staff issue or something else. But this is a good check to do at least monthly to see how you're doing. So it'll let you know the breakdown through each category, which you're specifically funded for in your contracts. And it'll also give you an unduplicated count. So we see here that we only have 3 clients. That might be 30. It might be 300. Our largest provider has about 1,600 clients that they report on a year. Okay, so we're going to keep that in mind. It's number 3. Out of those 3 clients, let's see who's missing what. So the way we do that, there's a couple ways, is we're going to look at this, go to the custom reports first. And we're going to look at our date span. Again, we want to run this for the entire year. If you're only running this for, say, October, you're going to get incorrect and inaccurate results in your missing data reports. The date span, it's always a calendar year in CAREWare, and it doesn't hurt to run from January 1st through December 31st, even though we're not quite there yet. And the other thing to check is on the right-hand side here, there's several check boxes available. If you have show new clients only, that's going to skew your data. That's just going to be the new clients. So what I would recommend is that you have checked show clients with services only, and you sum the numeric fields. You don't really need to show the report specifications. So the second box and the fourth box is what I would recommend that you have, as well as the date span for the entire year. The first report we're going to look at is this TLS missing Ryan White eligibility, and you want to click Run Report. This is what you want to find. If there's any clients that are showing up on this, for instance, I might take out the eligibility record for John Smith. If there's any that are showing off, you're essentially not getting any credit for the work you've done, either services or screenings, labs, anything that you've done is as if that client doesn't exist, and it's not going to be reported to HRSA on the annual report. So again, what the cue on this, where it comes from, is in the eligibility history records that you add. So done right, every 6 months there should be an entry in here. Done incorrectly, if someone was not updating this, or if they're changing the existing records to the current date, that's going to skew your data and you're not going to get full credit. Let's just say in this case that for whatever reason, back in 2017, maybe they relocated, and I'm going to say that they're not eligible for Part A. Okay, so when I run this custom report, and it's going to be the TLS missing Ryan White eligibility for all of 2018, that John Smith should show up there. And that's because I have services, but I haven't told CAREWare that he's still eligible. So he had services in October of this year, but the last time the eligibility was updated was back in 2017. And please check this at your agency. This is the first report, so you make sure to get as much credit as you can and full credit for the work you're doing. All right, the rest of these reports, the annual review, regardless of if you're a support site or a medical site, these reports should be cleaned up exactly the same way. You shouldn't be maintaining hundreds of clients on this every single month. It should be cleaned up. We're well past the midway point, so both of these next reports should have no records found. Let's look to see the annual review. Okay, and I have two that are showing up. All right. And so you see here that all the information is complete, but the issue here is that the household size and the income have been reversed. So to fix that, let's just go back to John Smith. And I know that that's the annual review, so that's the tab that I want to go to, is the annual review tab. And sure enough, I see here under the income that I accidentally reversed these, so let me go in and edit that. And I'll just put the 12,000 in the income. I don't need any a dollar sign or punctuation. And the 2 in the household. That record should now be complete, and when I rerun that report, he should have dropped off of it. And if you do have quite a number of clients on this report, it's got to be fixed anyway. It's going to be critical. So my suggestion is that this be your priority, and that or whatever staff you're going to need to correct this, that you get this corrected and the information input for this reporting year as soon as possible. And it's the same thing with the rest of the reports. They're checking for different things, but they're also going to flag records that normally wouldn't be flagged even by the RSR and by HRSA reports that are built in. So in this case, everything is good. We've got insurance, housing, and income. It looks like they have received risk counseling, but they haven't received the mental health or the substance abuse screening for the year. So those would need to be updated for sometime during the reporting year 2018. You want all these reports to have no records found. That's the goal. That's what you want to see for all of them. Some reasons you might see clients popping up on this missing client status is maybe you discharge them or you close out their account, but you didn't put in a close date. Some other typical reasons I see when monitoring is Maybe you have the information, but you have the HIV risk as unreported or not specified. And then finally, the missing demographics. Again, we're running this for the entire year. None of these reports do you run for just a month. And it looks like we have everything's in pretty good shape, except for the zip code is all zeros. So, don't try to get around the system by putting in all zeros or all nines or leaving it blank. The system is going to flag it for you. So you just go in and try to qualify with a accurate zip code. And then the final check is going to be, we're going to look at the RSR report itself. So to do that, you go to your main menu, you go to Reports, HRSA Reports, and the RSR. Make sure you're running for 2018. If you're a medical site, under Options, there's this Use Shared Lab Data. Feel free to choose that. What that's going to do for you is, let's say you didn't get a client until mid-year. Maybe they transferred in from another clinic that was in the within the TGA. This will just help to complete your data. Maybe they had some previous labs or screenings, and that will help to complete the data for your RSR. So if you're a support site, a case management, or another support service, you don't need to worry about this. This is only for medical sites. This is a two-step process. The first thing we do is we create the RSR client report. I click Create. It's going to ask you where you want to save it. I would recommend that you just save it on the desktop just to make things a little easier. So it's actually going to save this file on the desktop of my computer. Hit Save. We're going to let that finish. For those of you who have a lot of clients, hundreds or thousands, this is going to take quite a little bit of time to run. You let that complete. Okay, this is what we want to see, even though it's just sample data. Clients with missing or out of date annual review data, there's none. So we're not seeing a red. The data is complete. However, the clients that are reported, there's only 2. You might recall earlier when we ran the financial report, there was 3 clients. So the issue is we've got 1 client that's not eligible. So again, it's as if they don't exist. Any services, screenings, labs, anything I've done for that client, it's as if it never happened. So that's why you want to run that custom missing Ryan White eligibility first, so you can get all your clients eligible that you can. Let's just click OK. We're just going to go with this as it is. I ran the report. Now I want to look at that report in the viewer. Click Client Report Viewer. There's 2 ways to get back to that file. If you're familiar with the browse function, you can click on the ellipsis here, or you can just simply click F1, select RSR file, and you would navigate to where you're saving that file. I just put it on the desktop, and I open it, I click on it, highlight, and open. So here's your actual report. Of course, you're going to have more than just 2 clients. But as you're going through here, what we're going to do is go through each of these indicators. This is the actual report. You might want to do a couple things, like if you have a deceased client, you might want to just make sure that it was coded correctly. When you're using this real-time lookup, there's 2 things. You click on the client you want to go to, and then you choose the section of CAREWare that you want to review. The enrollment status is, you'll get familiar, is going to be on the demographics tab. So that's the section that I would select. There's 2 ways to get to the client. You highlight the client and click Go to Selected Client, or you can double click the client record itself, the client name. And so this looks to be complete. So the client is deceased. I have a deceased date. I have a referred or discharged on a date. And let's just see if my eligibility history has been updated. And it has. So I said that on the 21st, they're no longer eligible as they were deceased. So that would be how they'd be properly closed out. And just a tip here, it's okay to provide services after the date of death. Maybe there was some, non-medical services going on, or some coordination of care. That's okay. But the last service was 6/20. So when you're putting in a close date, for your eligibility, make it 1 day past the service date so you get credit for that. So your last service date was actually the 20th of June, and if you code this with the 21st or beyond that for eligibility, then that way you get full credit. So, and what we're going to do is just go back to the RSR report. We're just going to look at any sections where there are missing or unknowns. So each of these sections, this all has to do with demographics, gender, sex at birth, poverty level. For those of you who have consistently a lot of clients with missing annual review, this is the first spot they're going to typically show up, is under the indicator number 9, poverty level. Housing status is going to be a big one. And then finally, the medical status. And in this report, it's showing that we're not having no clients are missing information. Let me just click on this. Any of these that are out of program compliance where you have clients that are missing or unknown, all you need to do is click on the link itself. In this case, you see 2 for CDC-defined AIDS. And CAREWare is going to automatically pull up those records. And it doesn't matter if you've got 10 clients, if you have 100 clients or more than that, your complete list of everyone who's missing that specific field is going to show up here. So there's no guesswork in this. It's just a matter of maintaining clean data and just going into this every single month before you submit the reimbursement and cleaning up your data. Okay, so no guesswork. The top section is all demographics. The bottom section, the middle is shows your services. And this report could even be used if you want to just get an idea or just review the clients, say you were doing medical case management for. You can go to that service section and click on the clients, and it'll show you exactly who those clients are who are getting those services. And then for the medical sites, the clinical information is all listed in the bottom. So I think I mentioned earlier, as soon as you have a medical visit, then CAREWare says, okay, not only do I need just the basic info, income, insurance, and housing, I also need all the clinical. I need the CD4 and viral load for this year. I need all the screenings. When you go down and look at any of the clinical indicators, and that's going to be all the numbers 46 all the way down through the bottom, please look at any of the responses, especially the no or missing, where it's more than 10%. I think there's a little confusion on CAREWare. You're not showing anything missing and you're thinking your data is complete. But also within these categories, a no is really a default, which means that they have not received the screening. So when you're actually at your agencies, when you're reviewing the clinical, please go through each of these clinical indicators, each of these sections, each number 54, 55, and try to recode these. If they're a no and it's more than 10%, maybe they should be reassigned to not medically indicated. So it'd be pretty easy to click on which clients are listed as no and reassign them, or if you have values, put in the actual results from the test. But recall, it has to be for the current reporting year, which is the calendar year. So that is the missing data section. That process that I just went through, it's to be done every single month. The other part that goes with this is the billing, and let me show you what that would look like. So let's say in our financial report, we're just going to look at, let's say, October. So I run it for the entire month that I was interested in or that I have data in CAREWare for. Let me run the report. And I just have the one from today, but that's okay. That'll be good as an example. We see this will give you your total client count and then the total number of units. So we've got just the 1 and the 14 units. So if I was actually doing a billing for this, I would run this report just for the month because it's billing. I go back to my custom reports, and you want to look at the fee-for-service detail. You're probably not going to have it's just going to say, it may not say billing, it may just say financial backup, which is the same thing. But let me highlight this custom report. And again, this is an exception. I'm not running it for missing data. I'm running it for billing purposes. So I'm just going to run it for the month. So from October, the 1st of October through the end of the month, and run the report. And what this would do is give me a breakout of every single time the client had a visit. So of course it's a very small sample here. Your list is going to be much larger, but it still should reconcile with the financial report that I ran just for the month. The financial report for the month said I had one client and I have 14 units. And you see here under my quantity, I have 14. So the financial and then this billing or the financial backup also needs to be submitted with your invoice or with your reimbursement request to the county. But this should not happen until your data is all cleaned up on all these missing data reports. So the billing.
So I think, Bill, that's an important part to highlight. Billing should be done. You should establish your internal processes for your deadlines as to when the data is submitted, either put into CAREWare by individual staff or submitted to a person to be put into CAREWare or submitted to be uploaded into CAREWare. And then once that's done, then billing can be done, and then the invoice can be sent. You should never get an invoice with no data in CAREWare. It will go back.
Right. Yeah, so that's, I mean, you want to get reimbursed as quickly as possible, of course, and so the data is going to be tied to the invoicing. So incomplete data is could delay your invoice, your reimbursement for sure. But basically, yeah, no data in CAREWare, you shouldn't be billing. You should be submitting your request.
And then, for instance, another example, especially if you have maybe established units. If you have a unit in CAREWare for like a lab that has $150 tied to it, and then we look at the financial report and there's no, so it's billed to us in the overarching financial, but in the backup financial it's not even listed. That should never happen. The data should be reconciled and looked over by whoever is putting that billing together, or if that medical case manager is responsible for that portion, or that medical staff is responsible for that portion. All that should be looked at before it's submitted for invoicing. And then we also look at productivity. So I mentioned earlier about half the time should be logged in CAREWare. So if you are a full-time nurse on the Part A program and you have maybe 20 clients in for the month and 40 units listed in for the month, that's probably not where you should be. Now, if you're billing for a full-time person, you really need to go back and take a look and say, was it a slow month, or did I not bill for 20 of my clients or 30 of my clients? And then make sure you're also putting in, if you make phone calls for clients, it doesn't have to just be face-to-face. Anytime you're spending helping that client, whether it be on the phone or so forth, that should be documented for that client on that day as a service.
Great. So the last part that I had was just a couple quick summary reports that you can run just to kind of keep track of how you're doing for the year so far, or maybe a month or a quarter. So I'm just going to jump back real quickly from the main menu. Let's click on reports. You're familiar with a financial report, but I want to just show you a little trick here. If you run this for the entire year, in the middle there's a little checkbox, include subservice detail. You actually want to use this when you submit your billing. I'm just going to run it for the whole year just so we get a few more returns on it. Now when you do this and you run with that subservice detail, it'll show you all the drop downs, which are the specific subservices themselves. So in bold is the service category that's defined by HRSA. And then within those are the sub-services. So this is a quick way to see, like in this case, we can see how many medical labs we had versus a nurse visit. It'll make more sense to you. You can see how many parking tickets you had, or maybe validations versus bus tokens, or depending on what your category is, how many assessments you had versus EIS, lost to care, or out of care. So a quick way just to get some subtotals that could be useful internally. Again, it's going to give you an unduplicated count within each of the service categories. So it's a great report, not just for an accounting basis, but pretty much for even your case managers. You want to see how you're doing as far as client utilization goes, or service utilization. So in this demonstration, we have 3 unduplicated clients. That's good, but we don't know anything about them. We don't know any demographics. So a quick way to find out what your breakdown is of your clients themselves is to run the RDR report. So let me close out of the financial. I'm going to click on the HRSA reports, but instead of running the RSR, which is the Ryan White Services report, I'm going to run the Ryan White Data report, which is an aggregate form. I'm going to make sure I run it for the same date span for the entire year, 2018. You don't need any other checkboxes. You don't need Part C or D. And your reporting scope can be for all clients. That's fine. And then you just click Create RDR. Again, if you're a larger agency or you have a lot of clients, it's going to take several minutes for this report to finish. And so here it is. Here's our total of unduplicated clients. It's 3. And here's our breakdown. It'll let me know if there was any new clients within the reporting period, what the gender breakdown is, the age breakdown, risk factor, race, ethnicity. And the way you scroll down on this report is at the top there's some green arrows. You can see we're at page 1 of 4. I click the next page. This is a lot of your annual review information, your basic. Here's your medical insurance. You can quickly tell how many have private insurance, how many have private individual, how many are classified as Medicare or Medicaid. Poverty levels. It might be just a quick reminder for you too. Do you have anybody that's above 500%? Maybe that's an error. Maybe it was a typo when you inputted the information, or maybe they shouldn't receive Ryan White funds. Here's your housing status. And then for a medical site, I'll show you the service information. It's on page 3. This has one useful information here is that it breaks down each of these core services and the support services. It also gives you the number of visits. So it's different than the number of units. It'll actually tell you how many visits the client came in on, how many individual days. And sometimes this is a hard number to come up with. You can easily look at that in this RDR report, so it can be useful for that. And then finally, the last page would be more applicable for medical sites, but very quickly, it's kind of a summary of all your, a lot of the clinical indicators. It'll show how many of your clients are CD4 counts are above 200, how many are below, how many, if you have any that are newly diagnosed with AIDS this reporting period. And at the very bottom, they've just got some information on screening information for Hep C, syphilis, TB, and then the Pap smears. So again, it might be useful. Any of the reports in CAREWare, you can, if you click up in the corner here, you could view it as a PDF, and then you could save it. And you can also, if you click on this export report document, to me it kind of looks like the Under Armour logo. Whatever helps you to remember it. If you click on export, then any report you can save on your computer, or you can archive for purposes if you want to. Just be aware that if it has any client data in it, specific protected or personal health information, just be sure how you manage that. So this will give us our demographics. That's the kind of the purpose of showing you this one. So now we know a little bit more about those folks, but at some point we're going to want to know who those individuals are. And so for that, we're going to go back to a custom report, and we're going to look at the TLS client list. Again, just make sure you run it for the same date span, and you'll get the same amount of clients. Let's look at all of 2018 and run the report, and it should show all three of those. And there we go. So that kind of concludes the CAREWare 101, the overview. Hopefully we've demonstrated where to put the data in, how to do the data entry, what the expectations are around data cleanup, which should happen every single month. We shouldn't see the same errors and data repeated month after month where it's not being cleaned up. And then finally, just some quick summary reports that you can run internally. And then not just for billing. After all your data is cleaned up, then that's when you prepare your monthly reimbursement reports for to send to the county.
So I would just ask if Melissa Collins has any other highlights in regards to electronic eligibility she wants to mention.
For the which one?
For eligibility?
Yes.
I think another thing is when uploading, if you guys have any kind of errors, just make sure that you're letting me know. I'm happy to go in there and delete the file. That's not a problem at all. But also when you're collecting the documents to upload, if there's an excessive lag time, what I'm seeing with some agencies, they've collected the documents, there's a lag time, and by the time that, we'll say agency A gets around to uploading their eligibility documents, somebody else has already done it, and then there's duplicates in the system. So just making sure that you're going in and checking that somebody else hasn't already done the eligibility. And then again, so if somebody hasn't, then you go ahead and you collect the eligibility documents. And then right before you go to upload them, make sure that, if it's been a couple of days or something, that you go and check to make sure that somebody else hasn't done it in the meantime. Because I'm seeing quite a bit of duplication. That maybe somebody collected it on a Monday and they waited a couple weeks, and in that couple weeks that client showed up somewhere else, and when that person looked in the system, there was no updated eligibility in there, so they went ahead and did it and uploaded it immediately. So
I think this is important, and this is a big point in regards to it's a contractual obligation, as well as the point of it is to make sure that the clients are not asked to do additional work, and then also providers aren't doing additional work that has already been done. So we will be reaching out to folks. We're monitoring this closer as we have been implementing this over the past year, 2 years. So we're asking folks to make sure you're sticking to that required 3 days of uploading. If you do need additional staff or making aware of issues you might be having, then please make sure you're reaching out to me if you're having problems, and making sure that we can get you resources that you might need to accomplish that task.
And then I guess I just really wanted to reiterate what Phil said originally is please make sure that the documents that you're scanning are legible. If you upload a driver's license and it's blurry and just kind of a blob on the page, that's not going to be helpful to anybody. So maybe there's an internal issue, or maybe it was accidentally a blank page, and we all do it, but just double checking that your upload is legible and easy to read for everybody. It's appreciated.
And along with the monthly data deficiencies, we're also attaching the Cleveland CAREWare manual. So again, this would be kind of your primary source to go to if you have any questions or for review. And then if there's something beyond that or specific to your program, just please contact the Ryan White program office first. If it ends up that it's a support issue with CAREWare, then they'll let me know. what my role needs to be, if I need just checking that on my own, or maybe set up a remote training or a webinar with an agency down the line. Should we see if there's any other questions before we break here?
Yep,
I think we're getting kind of close.
Yep. Any last questions, anyone?
I'm not seeing any in there right now.
Do you want to unmute everyone? Can you do that quickly, or just to make sure? Or
Are we glad to unmute your line? If you just want to type your name in the chat box, and I can unmute you. And if you'd like to ask a question to the group, feel free. Okay.
all right. Well, thank you, everyone, for joining us today. And if you have any questions, feel free to contact our office, or make that first reference to the CAREWare manual. And thank you again for joining us today.
Thanks, everyone.
Thank you, Phil.
You bet.
Thank you, Melissa.
Thanks.